Good morning, everyone, and welcome to the first panel today. This is about Finnish expertise in digital transformation. This session is our answer to the Polish stakeholders, how Finland make e-health so successful story by the real examples. My name is Agnieszka Wrubel, and I'm working for the Business Finland organization in Poland, and I will be hosting you today. I'm extremely excited about present you the real strengths of the Finnish technologies. We are joining today by representative of 3 different companies. So now I would like to introduce and warmly welcome Toni Leinonen, CEO and co-owner of company called Nukuta, to present the very interesting topic of remote monitoring and diagnosis for the human respiration system. Good morning, Toni.
Thank you very much. It's a pleasure to be here. So I hope everybody can see our presentation. I'm going to try to take control and see how this works.
Yes,
it seems it's working now. So we at Nukuta, we develop technology for remotely monitoring and diagnosing the human respiratory system. There we go. Now I'm able to change slides. We have developed our device since 2015. We have now received CE approval for our diagnosis tool for sleep apnea. We have now extended that to do monitoring for patients with some type of respiratory infection to detect ARDS caused, for example, by COVID-19. This technology is in pilots right now, and we're working on several other diseases in our pipeline. So respiratory diseases are, it's a huge problem globally. It's growing all the time. Right now there are about 3.7 billion cases globally. Obviously these overlap to an extent, but it's a big problem. Everybody knows somebody with some type of respiratory problem. And our solution is our proprietary collar with our attached cloud service that can basically be used in the future to monitor and diagnose any type of respiratory problems and diseases. The device comes in a nice case that can be sent to the patient. The measurements can be done at home or at the hospital, and it's very simple, intuitive, and easy to use. We get high reliability of measurements, and they're also repeatable for research purposes. Overall, it's a nice, reliable package, and very easy to use for the patients, and also fast and easy to use for hospital staff. So what it basically does is, in most cases, we have our color sensor, including a pulse oximeter, and then there's a tablet computer, at least in the first generation device, because it's mainly meant to be used in hospitals. We record the data, the tablet sends it to the cloud where our algorithms work their magic on the data and present the doctor with pre-processed data to support diagnosis of certain diseases. And as I said, sleep apnea is available commercially today, and monitoring for COVID-19 patients is in hospital pilots, and will ship during Q1 next year. This is our clinical roadmap. As I mentioned, we're adding more diseases all the time. And some of them are even missing from this presentation, since this isn't our latest one. We're also working on a next generation device. That project has started in the autumn, and that will bring the costs down, and we're targeting to have this available even more widely for direct to consumers for diagnosing different types of diseases with the help of doctors. For our COVID-19 monitor, our view is that we don't have enough visibility on how patients are recovering, both in hospitals and at home. And what we foresee would be that when a person is diagnosed with COVID and they're sent home to recover, they would be given this device or a similar device, and their health would be continuously monitored. And if their health deteriorates, they could be automatically brought into the hospital. Our technology is in pilots right now, used in hospital wards where we monitor the patient's heart rate, blood oxygen saturation, and also their respiratory rate. Those are the main biomarkers used in determining whether ARDS is beginning to show up in the measurements. And then there's a lot of stuff about how expensive hospitalization is and business model and stuff, but this is for mainly funders. I think this is what I wanted to say. This is what we've done. There's a lot of interest in all of our new stuff and the sleep apnea part. And anybody interested in looking at our technology more closely, interested in any type of research or clinical cooperation, looking to do a pilot with us, please get in contact with me, and we'll see what we can do. All right, thank you very much. That's it for me.
Thank you very much, Toni, for this very interesting presentation, especially sharing with us that the system works for the hospitals and can save the resources there, which is a problem nowadays. And what is interesting also for me that you can also use it for home setting, which is another probably direction nowadays.
Yes.
I would like, as we are in the middle of our session, and I think that our brain are working efficiently nowadays, I would like to warmly welcome next generation brain monitoring company and Mr. Jukka Kortelainen, CEO and co-founder of a company called Cerenion. Good morning, Jukka. Are you with us?
Good morning. I'm very much here. Thank you very much for the introduction and of course for the invitation for this interesting event. So I'm here to tell you about Cerenion and the technology we're providing. Cerenion is a 3-year-old startup company from Oulu, Finland, as the previous company Nukute also. And our mission is to improve the patient care by advanced brain monitoring. So Cerenion was founded in 2017 as a spin-off company from University of Oulu. Before founding of Cerenion, we had been carrying out research related to Cerenion's technology already for about 15 years at the university. Today, we are 8 people, most of us working here in Oulu and some also in Vantaa, close to the capital area of Helsinki. In Cerenion, we have created a medical software for automatic analysis of EEG, or electroencephalogram. And our first product, called C-Trend, was actually just EC certified meaning that it will be launched as a CE marked medical product within few days. So we are living very exciting times at the moment. As some of you probably know, EEG is a recording of the electrical activity of the brain, and it is widely used in the hospitals today. However, the use of EEG in, for example, intensive care or emergency environments is quite limited by the fact that EEG recordings are difficult to carry out and also slow and laborious to interpret. In fact, a trained specialist is needed for the interpretation of the recording, and a specialized technician is needed for carrying out the recording. So we have created the C-Trend technology to help in this challenge. In C-Trend, artificial intelligence is used for automatic analysis of EEG. So we produce from complex EEG recording a simple parameter that is easy to use by the doctors who are not experienced in EEG interpretation in their everyday work when doing treatment-related decision-making. So as I already said, C-Trend is based on more than 15 years of research, and it has gone through extensive clinical validation before now entering the market as a commercial medical product. The product has been especially designed for critically ill patients, as well as patients who are in a high risk of developing neurological complications. So with C-Trend, we can now include real-time brain monitoring to the patient care in a practical manner. C-Trend can be used in several different environments and care paths in the hospital, including post-operative care, intensive care, and emergency. So one example of a scenario for using C-Trend would be with a patient going through a high-risk operation, such as heart bypass surgery. Because of the nature of the operation, the patient's brain is in a risk during the surgery and also after it. However, with C-Trend and with our technology, we can easily monitor the brain function throughout this risky operation and through the care path from the surgery to the cardiac intensive care unit and support the recovery of the patient. Another scenario to use C-Trend would be when evaluating the recovery of a patient after cardiac arrest. So these patients typically suffer the cardiac arrest outside hospital. They receive CPR on the field and are then transferred to the intensive care while still being in coma, unconscious. And the reduced oxygen supply to the brain during the cardiac arrest may have caused permanent brain injury to the patient. And C-Trend can be used to evaluate the recovery of the brain function and help in the treatment of the patient. We can also use C-Trend to evaluate the brain function of stroke patients in the emergency or neurological wards, for example. So stroke is caused by poor blood flow in certain area of the brain, and it has immediate effects on the EEG and the electroencephalogram from which C-Trend is calculated. So C-Trend can be used to evaluate the brain function during the stroke as well as during the recovery of the blood flow, for example, as a result of a successful treatment. So, as I said, we are just about to launch C-Trend as a medical product, and it will be first available on a platform called BrainStatus. So this BrainStatus is an advanced technology for medical-grade EEG recording, and it's provided by a Finnish company called Bittil. It is full kind of a solution for practical EEG recording in hospital environment, and it includes disposable electrode attached to the forehead of the patient and a wireless recording device. And the device is connected to a tablet computer, also wirelessly, from which the medical staff, for example, in the intensive care, can see the EEG recording and the C-Trend analysis. And the recording can also be accessed remotely from different locations by an EEG specialist for more detailed analysis. So the system with C-Trend provides a very convenient way for EEG recording and analysis in the hospital environment. We would be more than interested in bringing C-Trend to the use in Poland. The first step for this would be to arrange piloting in one or more Polish hospitals. So if you are interested in collaborating with us on this, please let us know. And you're also very welcome to follow us in LinkedIn if you use it, and feel free to connect there also with me. So thank you very much for your time, and I hope to hear from you soon.
Thank you very much, Jukka, for the excellent presentation. And especially in the times that the hospitals are looking probably for improvement or optimization for the intensive care costs, which are highly high nowadays. That seems really interesting. I have a question to you about this emergency place when the Cerenion solution could be used. Is there any requirements from the hospitals, from the IT, from the software that the hospitals have to use it at the emergency?
So yeah, as I explained, we are a software company, so our software has to be integrated into with an EEG recording device, and the first integration is done on Bittium's brain status platform. But they provide a full EEG recording system. So basically, there's no requirements whatsoever regarding the previous EEG systems. We can provide a full EEG system with the C-Trend analysis included with Bittium's product. There is an option for this remote access, for example. So that should be negotiated with the hospital, so that with the IT department, so that if we can access the system outside the hospital and so on. So there's some negotiation with the IT department that needs to be done, but there's no previous requirements regarding the EEG system whatsoever.
Thank you for answering this question.
Thank you.
Okay, I would like also welcoming our next guest speaker. And welcome Patrick Francke from company @Simo. This time we will hear more about the requirements of the data-driven care need assessment. Good morning, Patrick. Are you with us?
Good morning. I'm here. Thanks. Thanks for the intro as well. Yeah, I mean, as mentioned, I'm not going to be doing a normal pitch regarding what @Simo is offering at the moment. I thought I'd take this time to introduce our roadmap and our partnering activities when it comes to how we evaluate partners and what type of activities we're going to be having in the future in collaboration with our partners. So this could be a matchmaking presentation more than anything else. And for my part, I'm responsible for business development at @Simo and been doing these data-driven healthcare activities for about 14 years, and I'm really hyped about what this company is up to at the moment. And now I'm hoping I don't have any technical difficulties here. Let's see. Perfect. To interpret what's said on the first slide, we have an extremely well-functioning machine learning platform, which is tweaked and built to drive care need assessment. So basically, we're trying to help the healthcare sector, meaning providers, insurance companies, as well as the end users, meaning patients and customers, to have support from a sophisticated machine learning tool to evaluate what type of care is needed in which case. So this is what we do. And at the moment, we have something that people could call a symptom checker, which means that a patient inputs different symptoms into the engine, and then the engine starts asking questions regarding sort of like additional symptoms that the patient might be suffering from. In that way, we can come up with a care need and care urgency, as well as a pre-diagnosis. So this is what we have at the moment. I'm going to go through the logic on how we plan on ramping things up in Finland and developing this to sort of like answer questions on more demanding use cases. As mentioned, or which I tried to mention, we highly prioritize collaborating with partners. In this case, we have an investor, the largest healthcare provider in Finland, called Terveystalo, whom we are building our capabilities with. And then we have a partner in Brazil as well, which is giving us access to, I'm guessing it's 60 or 70 million population at the moment in Brazil. And the partner's name isn't Minas Gerais, it is Tech Tools. But with both of them, we are collaborating to build on our current capabilities and do something magnificent. These are the cliches regarding the status of e-health solutions and remote care in general. But I mean, you've all seen the trends, AI, physical activity monitors, cheap diagnostics. All of these things are driving healthcare to something that might to some people mean scary and unknown, but there's a lot of potential when it comes to giving access to people in rural areas, for instance, and making diagnostics more accurate and going into prevention and the like. So there's a lot of things going on that in my perspective, I think they are changing the sector into a better direction. And COVID-19 might be one of those things causing a tipping point and then making things accelerate when it comes to the transition. I'm going to go into the logic of what we do and how we build it, and try to explain also how, what type of ecosystem is needed and what we want from partners and customers as well to build on our capabilities. When it comes to patients having different ailments, what is usually done is you somehow conduct a care need assessment, either by an AI or a doctor or whatever. Someone makes a decision on what needs to be done next. If there's a need for care, then you have something called an intervention or care or instructions or depending on the need, whatever it is, on the indication. And then you have, once the care path or care episode is ended, you have recovery and you might have case monitoring and the likes. At the moment, we use or intend to use all of these different stages to build on our capabilities. And we use as data sources, we use, as mentioned before, symptoms and health history. In the future, IoT and wearables and the likes. At the moment, the focus is on symptoms, but also the health history part, which means basically EHR data. So this becomes a loop, something that we call data-driven healthcare and a learning health system as well. And all of this requires you to have an ecosystem, basically, and like an ecosystem that is data-driven, and also one that has certain criteria that I'm going to go into on the next slide. But this is what we're building at the moment, using symptoms and health history to build an AI that optimizes care need assessment and to some extent also care path optimization. But this is the gist of what we do. This might be a bit heavy, and I haven't presented this slide that many times. This is more of an explanation to the logic behind how data-driven healthcare should be should be built with what type of logic and what type of data. So I do apologize for that, for the sort of like busy slide, as well as the how should I put this? Well, heavy content in a sense. But if we look at care need assessment and what type of information is needed, you need the symptoms, you optimally need the health history of the patient, you need to physically examine the patient, and you need to evaluate their lifestyle as well. So this is an optimal case of conducting a care need assessment. All of these data points, all of these different pointers could be data-driven. The physical examination part, of course, might be a bit difficult, but the other parts are quite easy to quantify. When it comes to health history, we are basically at the moment talking about medical information regarding electronic health records, or if you want to call them electronic medical records, whichever it is, but the repository that consists of each and every patient's examinations and health history, ICD-10 codes, whatnot. And that also consists out of genomics and risk factors regarding your health. So history from EHR data, as well as your heritage in a sense. The aggregated health data, meaning EHR data, in Finland consists out of very structured primary care data, as well as secondary care data and social services data. So all of these data points are necessary to have a holistic perspective of an individual's health history. I'm going to go into details in a second. Then when it comes to examining the patient, you might do a part of it via remote solutions, as for instance, a video. I mean, that might not be as suitable as a complete physical visit, but it's something that could support if there's no face-to-face capability. And then you could get some support into this examination by IoT and cheap diagnostics as well. So this is me trying to explain how things could be done remotely as well as data-driven, and thinking about different data sources that are needed. Lifestyle at the moment is pretty much self-reporting related. It could be supported by IoT and wearables data. But with the help of this data ecosystem / information ecosystem, we can conduct a feasible care need assessment. We can drive the patient through proper production / intervention, which means that you go through a certain type of care path. And then you have the recovery / case monitoring part. But all of this should provide and does provide us with EHR data, for instance, electronic health record, medical record data, which then gets fed back to the systems. We get ICD-10 endpoints, which means diagnosis. And with the help of these, we can create something that's almost self-learning.
Patrick, thank you very much for the presentation. As the time is running, I just would like to say to our participants that all the speakers can be contacted directly for follow-up questions that they might have. And I very much would like to thank. I'm so thankful for all of you to being with us today and to see the aspect of the Finnish strength for digital health technology. And I hope that the audience also join me to thank you, our excellent speakers, Finnish speakers today, as the same as the organizers of the e-forum this year, 2020. Thank you very much.